Hello, I am Lisa Obradovic and would like to welcome you to the Certification Inspiration podcast produced by the Wound, Ostomy, and Continence Nursing Certification Board, otherwise known as WOCNCB. Founded in 1978, WOCNCB is a not-for-profit international nursing organization board certifying over 10,000 nurses who are specialists in the field of wound, ostomy, continence, and foot care. In this episode, we are highlighting the WOCNCB Public Policy and Advocacy Committee, otherwise known as PPAC. We are joined by three volunteer members of the committee, Teresa Gentry, Christine Pulaski, and Jennifer Yeckley. Welcome, everyone. Thank you for joining us today. Teresa is a nurse practitioner certified in both wound and ostomy care. She lives in Arizona and has served on the committee for the past 4 years and is currently the chair of the committee. Teresa works in a hospital-affiliated outpatient wound clinic and sees patients with both ostomies and wounds. She also does inpatient consultations as needed for 2 local hospitals. Christine joined the committee in 2023. She is a certified wound ostomy continence nurse and works in both the inpatient and outpatient setting at an oncology hospital in New York City. She treats patients with both urinary and fecal diversions and various types of wounds, including malignant ulcers and pressure injuries. We also have Jennifer, who is a certified wound and ostomy care nurse and has been on the committee for about a year. She works as an assistant nurse manager at Cleveland Clinic Home Care. Today, we're going to learn about the Public Policy and Advocacy Committee and what they focus on and how this committee works for you. Welcome, everyone, and thank you for taking the time to speak with us. Teresa, as chair of the committee, I thought we would start with you. What is the Public Policy and Advocacy mission and purpose?
Thank you, Lisa. I will mention that we do have 4 other members who are not with us today. We have Deanna Vargo, Kimberly Gondos, Stephanie Malik, and Yvette Conyers, our board liaison. We're usually a group of 8. We do have 2 new members starting in January, and all certified nurses. And we have the mission to share important legislation and regulation changes with wound, ostomy, continence, and foot care certified nurses and their patients. We also strive to educate legislators and the public on the vital role of certified nurses in providing quality, cost-effective care. And we hope to empower certified nurses to drive meaningful change for patients and caregivers.
That's great. What are the members doing to support this mission currently?
So each of the committee members are assigned websites to review for any new or possible changes to legislation. Some of the websites we review include the UOAA, the WOCN, CMS, the NPIAP. There are also several other websites we look at, and all of these are listed on our webpage at WOCNCB.org if interested in seeing all of those websites we review. So we look at these websites and then we come together monthly and we discuss any pending, proposed, or new regulations. From there, we decide if any action is needed, such as writing a letter of support or submitting a comment during a comment period. We also collaborate with the WOCN Society, the United Ostomy Association of America, and various other coalitions working on wound, ostomy, continence, and foot care issues. We then will share any significant changes, alerts, or resources with certified nurses. We do this through our webpage, a section in the board's quarterly e-news, or by doing a podcast such as this.
This is important work. You guys are really busy, it sounds like. And it's great. It's all volunteers, all certified, board certified nurses. Christine, can you share some of the public policy issues that the committee has worked on and had successes recently?
Yes, an example of a public policy issue that our team has successfully worked on is the Lymphedema Treatment Act. This was passed in December of 2022. Our committee supported it for several years before its passage. It provides new coverage for compression supplies. Medicare will now pay for 3 daytime garments per affected body part every 6 months and 2 nighttime garments per affected body part every 2 years. Additionally, they will pay for necessary accessories such as donning and doffing items, fillers, lining, padding, and zippers. Some of the continued barriers include requiring additional work, including payment for time spent measuring the limbs and educating patients on its use, and payment versus cost of product. We also presented to CMS about healthcare common procedure codes, also known as HCPCS codes. In 2020, the WOCNCB submitted a public comment letter to CMS to support a change in HCPCS codes to add a code for disposable colostomy irrigation sleeves because the previous code only allowed patients to receive 4 per month. 2 committee members were invited to provide testimony to CMS on how this impacts patients. In late 2021, CMS made the request change to the coding and it went into effect in early 2022. In 2020, the Removing Barriers to Colorectal Cancer Screening Act was included in the year-end government funding bill. It took a decade of work to get it passed. This act phased out the out-of-pocket costs for colorectal cancer screening, including the cost sharing for polyp removal during a screening colonoscopy.
These are really big wins for the public and your patients. This is fantastic. And for those, I mean, CMS, there's a lot of acronyms in healthcare, and CMS stands for the Centers for Medicare and Medicaid Services, and it's a federal agency that provides healthcare coverage to more than 160 million people through Medicare, Medicaid, the Children's Health Program, and the insurance marketplace. So, this is great work that you're doing and great accomplishments. Jennifer, can you share what the committee is currently following?
Yes, thank you. Currently, we are following some exciting new news that is actually going into effect as of January 1, 2026. They are changing the way skin substitutes are thought of for both diabetic foot ulcers and venous leg ulcers. One of the things they're doing is redefining the failure. It's gonna be changed to 50% of the ulcer area reduction in a 4-week period is gonna be the standard of care. So that's what they're expecting. The docs are also gonna be limited to an application limit of 8 skin substitutes applied over a 16-week period. And CMS just changed the way all of this is paid for, and their new list came out with the fees that will be done for this. And that all goes into effect again January 1st of the coming year. We also we're following pretty closely the I CAN Act, and it was a bipartisan bill that got introduced in the 118th Congress in 2023 and 2024. It's doing with advanced practice nurse providers and the way that they can deliver services. It's kind of across the continuum from cardiac pulmonary rehab to Medicare shared savings programs to home infusion therapy and hospice. Also involves some skilled nursing facilities and inpatient care. However, it did go to the Health Subcommittee on December 17th of 2024, and we have not heard any progress made since then, but we are still keeping a close eye on it.
Great, great. So important. I know there's a lot to follow, and I know just working with the WOCNCB that pressure injuries are a huge concern in healthcare. I understand there are proposed electronic clinical quality measures you are following. Teresa, can you share more information about this?
Sure. Yes. Thank you. This is a big change coming our way. It's the Electronic Clinical Quality Measures, ECQM. And there are several ECQMs active. However, this is a new concept in pressure injuries. Hospital harm pressure injuries CMS 826V3 is the specific measure. The process involves extracting data from the electronic medical record. This initiative is currently on a voluntary basis for calendar year 2025 and is expected to become mandatory for all in calendar year 2028. So, how is this different from the data that's already being collected? Well, facilities are no longer do start over. Facilities will no longer be doing audits and scrubbing data for accuracy before the pressure injury data is submitted. Additionally, stage 2 pressure injuries will be included, which is new to the CMS submission of pressure injury. The data submitted will utilize what is documented at 24 hours for stages 2, 3, and 4, and at 72 hours for deep tissue pressure injuries. So these are some big changes. We've been used to submitting data on our stage 3, 4, and stageable, but now they're going to start looking at stage 2s. So, what should we be doing now to get ready for this? I would suggest sharing the news. Let your administrators know how this new measure may impact them. You should probably start reviewing current protocols and ask, how can we best get the correct documentation recorded within the first 24 hours? You may want to start preparing nurses and doctors to differentiate pressure injury from moisture, skin failure, chronic tissue injury, and trauma, etc., other injuries. So we don't document new skin injuries during the inpatient encounter as pressure injuries when they have another etiology. Finally, we all need to stay alert for changes in this requirement. Things with CMS are constantly changing, and although this measure is set to be effective 2028, there could be changes or modifications to the rule at any time. This is a hot topic, so it's up for discussion.
Okay. Yes, that is a lot of changes. And as you said, it is voluntary currently, but it is coming. And so you need to stay aware um, and start preparing. With all these things going on, how do you suggest individuals contact their elected officials? For those who are interested, to contact them, advocate for their patients, advocate for protocols, what would you suggest?
Well, you can find this information on our webpage on the WOCNCB website, WOCNCB.org. Here you will be able to find out who your U.S. senators and representatives are and how to call or write them. If interested in writing a letter, there are often sample letters available if you choose not to write your own.
Okay, great. Well, this was very helpful information. I think it's important to share the work that you're doing on a regular basis and checking on changes happening in your specialties and how it impacts your patients and what you do every day to improve outcomes. Thank you for volunteering your time and doing this important work and sharing how other nurses and healthcare professionals can advocate for themselves and their patients. To learn more about the PPAC, go to WOCNCB.org, select the Public Policy tab. Thank you for listening. WOCNCB sets the standard for wound, ostomy, continence, and foot care nursing board certification by validating nurses' knowledges to provide safe, patient-centered care. Until next time, visit WOCNCB.org to learn more or contact WOCNCB at info@WOCNCB.org. And remember to follow us on social media. This podcast is produced by WOCNCB. Take care.